Are children more vulnerable and in need of photoprotection? Are children more vulnerable to the sun's harmful rays? The answer is yes, and understanding why is crucial for their health. Children's skin is different from adult skin. It is thinner and has less melanin, which is the pigment that helps protect against ultraviolet radiation. This means their skin can be more easily damaged by the sun. Infants and toddlers have especially delicate skin that needs extra care. Another important factor is that a significant amount of sun exposure happens during childhood. Studies show that about 25% of a person's lifetime sun exposure occurs in the first 2 decades of life. This early exposure can lead to DNA damage that builds up over time. Such damage increases the risk of skin cancers, including melanoma and basal cell carcinoma, later in life. Sunburns during childhood are particularly concerning. They are strong indicators of intense UV exposure and are linked to a higher risk of developing skin cancer as adults. As children grow, they also develop moles, which are important risk factors for melanoma. Increased sun exposure during childhood can lead to more moles, raising the risk of melanoma. While melanoma is less common in young children than in adults, it is still a significant concern. In fact, melanoma is the second leading cause of cancer among adolescents and young adults aged 15 to 29 years. Although the incidence of pediatric melanoma has increased in recent decades, recent trends show a decline due to better awareness and prevention efforts. Despite these risks, many children do not practice effective sun protection. Research indicates that fewer than 1/3 of youth engage in sun-safe behaviors. This highlights the urgent need for education and preventive measures that start early in life. So, what can we do to protect our children? Here are some practical steps for photoprotection. First, limit direct sun exposure, especially during peak UV hours, which are typically between 10 a.m. and 4 p.m. Second, encourage children to wear protective clothing, wide-brimmed hats, and UV sunglasses. Third, apply broad-spectrum sunscreen with an appropriate sun protection factor regularly. Lastly, promote sun-safe behaviors through schools and community programs. In summary, children are biologically more vulnerable to UV damage, and the early years are critical for establishing sun protection habits. These habits can significantly reduce the risk of skin cancer later in life. By promoting photoprotection from a young age, we can help ensure that our children maintain healthy skin as they grow. Always remember to consult healthcare professionals for personalized advice on sun protection and skin health.